My name is Dorothy Turitwenka, an Associate Consultant Anaesthesiologist with Mulago National Referral Hospital. An anesthesiologist is a medical doctor who has specialized training in anesthesia and critical care. We are going to talk about the pre-anesthetic review for patients going in for kidney transplant surgery. Normally, there are two patients. There's a donor and then the recipient. For the donor, we are interested in assessing for any comorbidities that would impact the surgery. So we'll rule out any chronic illnesses like hypertension, like diabetes, any infections like HIV, hepatitis, cytomegalovirus, and anything else. For the recipient, the assessment is multidisciplinary. So we'll do a cardiac assessment for their cardiac function, both an echo, ECG, stress testing. We'll also do blood work and imaging for both the donor and the recipient to make sure that they are a match. So the blood group, the cross-matching, the tissue typing, to make sure that there's minimized risk of rejection or graft versus host disease. Some other areas that we'll look at are the airway assessment, especially as anesthesiologists. We are very interested in the airway because these patients are worked on under general anesthesia. They are intubated, and then the surgery will go on. So we will assess the airway for possibility of a difficult airway, any masses around the airway, the mouth opening, and then if we will need to use adjuncts to intubate these patients. We also will give you fasting guidelines as a patient that has come in for the surgery. So normally for solid foods, heavy meals, we wouldn't want you to eat more than 8 hours to the surgery. For light foods, more than 6 hours. And then for babies who are on breast milk, not more than 4 hours to the surgery. And for fluids, we'll give you up to 2 hours to the surgery to take this. We'll also assess your medications, those who are on chronic medications, especially for the recipient patients. These usually are chronic kidney disease patients that have comorbidities like hypertension, diabetes. So we will evaluate your medications and say which ones to stop and which ones to take on the day of surgery. We will look through all your blood work investigations, look at your hemoglobin levels, the platelet levels, your renal function, your liver function, your clotting, to be able to prepare adequately as you go in for surgery.